Hey, this is Dr. Drew, and today I want to talk to you about the top 5 reasons why your injuries are not healing and you're stuck in pain. So one of the big things I treat in my practice is sports medicine injuries and anyone dealing with chronic pain in general. And I find that there's a lot of factors that improve healing, and there's also a lot of factors that harm healing. So I want to talk about some of the big things that you may be doing wrong that's preventing you from healing and recovering from your injury. And it's not just as simple as I'm getting older. That is a cop-out, that is an excuse, because let me tell you, if you do the right stuff at any age, your body is pretty miraculous and it will heal itself if you give it the right raw materials. So one of the first ones is poor nutrition status. So you're not getting the right nutrients in your diet, it's not coming in your body, and it's not getting to the cells and the areas of your body that need it. I've done extensive videos on digestion, gut health, and food selection, but it bears repeating here that you need to eat foods that like you. You need to eat high quality, highly nutritious foods that agree with your system, that don't cause inflammation, that are easy to absorb, that don't lead to gas, bloating, and stomach pains, because none of those symptoms are normal. So high quality proteins, fruits, vegetables that are low gas production, nuts and seeds is tolerated, high quality fats, avocado, coconut oil, egg yolks, nuts and seeds, that sort of stuff. Generally is a paleo-like diet. I like the paleo diet as a good foundation for most people. If you do have chronic health issues or other extreme gut problems, there may need to be some significant modifications there. But generally speaking, the paleo diet is sort of a good foundational place to start, okay? Also, some other things with healing and nutrient status. If you have a ligament or tendon problem or joint issue, you want to get lots of high quality protein and lots of collagen, because collagen is the precursor that helps you heal connective tissue, whether it's joint surfaces, ligaments, or tendons, muscle for that matter as well. Muscle is mostly protein, so you need to make sure that you're getting lots of that, okay? So poor nutrient status will blunt your healing all day. Number 2 is medications, painkillers, anti-inflammatories. So say you have a tendonitis and it's acute, and you injured it doing whether it's something at the gym or maybe you're playing rec sports. In the initial acute phases, when you're dealing with inflammation, controlling it is an idea. So whether that's with an anti-inflammatory or ice. But let me tell you, after 72 hours, if you continue to ice the area, if you continue to take pain medications and anti-inflammatories, you completely blunt your body's ability to heal. So if you take NSAIDs, ibuprofen, Aleve, the very inflammation that's happening there, your body's trying to use it to heal it. And if you keep shoving it down or blocking the response systemically, you're not going to heal. I do a lot of injection therapies in my practice, whether it's prolotherapy or PRP or trigger point injections, which actually kick up some controlled inflammation, some controlled acute inflammation. If you then go home and take a bunch of anti-inflammatories, it shuts down the healing response. So it's completely flying in the face of what we're trying to get the body to do. So one of the things I go through with people when we're doing the consent forms and I'm working on an injury with them, hey, this is the treatment we're going to do. This is what to expect after. Here's the do's and don'ts. You need to make sure not to take anti-inflammatories, because they not only wreck your gut and cause thinning of the mucus and ulcers and bleeds and all kinds of chaos if you take them all the time, they stop your body from healing. Plus, we also don't know how we're doing if you're constantly blocking that pain signal. So if you have a pain signal coming from somewhere, it's kind of on you to reach out to someone so that they can help you diagnose it and treat it. The more you ignore it, the louder it gets. First, it starts as a whisper, and then it graduates to a scream and a yell, and you just don't want to leave it till it gets to that point, okay? The next one is chronic icing. I touched on this briefly, but chronically icing an area is one of the worst things for it, because you need blood flow. You heal with your blood. If you don't have blood flow in an area, you can't get nutrients there, you can't build it back up, you can't heal it, you can't lay down collagen. None of that happens. Ice is just as inhibiting to healing as chronic anti-inflammatories I was just talking about. Just as bad. They've looked at this under ultrasound. The amount of white cells that flood the area normally basically goes down to like 10% when you chronically ice it. So it dramatically reduces the amount of white cells and blood flow and oxygen and nutrient flow to the area. So you do not want to chronically ice a knee. And again, when I say the word chronic, what does that mean? It means essentially anything that's been there for longer than like 3 to 7 days. You have this acute phase, which lasts about 72 hours. So say you step off a curb and you roll your ankle. It's going to blow up like a balloon and be puffy because that's acute inflammation. That acute inflammation will last around 72 hours. And then it enters what's known as the subacute phase. That'll last maybe a few days. And then by that 6th, 7th day, if the pain is still there, you're in the chronic phase. So when you're in the chronic phase, it's way better to use heat. If you're going to use cold, I would only recommend doing it with contrast, which is also good to do in the acute phase. So say it's in the acute phase, it's blown up, you want to put some ice on it, you can go back and forth with ice and heat, where ice squeezes the area, heat flushes the area. If you're ever going to use ice outside of that acute phase, it has to be followed up with contrast. But better yet, you're probably going to respond faster if you just use heat. So do not chronically ice areas. The only thing it does is numb the skin and numb the pain, but it doesn't help you heal. It may feel better on the area that you're trying to help, but it's not what you want to do long term. Number 4 is lifestyle factors: sleep, alcohol, smoking, stress. There's things we can do for our healing and things we can do against it. If you're not sleeping 7 or more hours a night, you're not going to repair and heal your injuries. That's when the collagen deposition happens. That's when your body actually patches and repairs, consolidates memories, drains your brain. That's when all the healing happens. So if you're getting less than 7 hours, forget it. Chronic alcohol consumption dehydrates the tissues. Most of our connective tissue, our muscles, ligaments, tendons, it's full of water. If you're using alcohol all the time, your liver, your system is trying to detoxify and shunt all the energy towards getting rid of that neurotoxin. Plus you're dehydrated, completely works against you when you're trying to heal injuries. So smoking as well. Smoking, we know, depletes all our vitamins and minerals. It drops our antioxidant status. It deprives tissues of oxygen. It's been well studied. The small vessels of the spine that feed the spine blood start to shrivel up and become inactive in chronic smokers. That's why some of my colleagues don't even treat the spines of people who are chronic smokers, because they know the blood flow and healing capacity there is completely shot because of the smoking. If you have chronic back pain and you can't get rid of it, this is a damn good reason to stop smoking, because that's one of the big barriers to health and healing. So don't smoke, heal faster, okay? Stress is another big one. Cortisol is very hard on joints and connective tissue. It chews at them essentially. So acute and little bouts of stress and shots of cortisol is great. It keeps us alive. It's vital to our survival, but chronic high levels of it, very degrading to the immune system and our capacity to heal. So it's kind of like a suppressor if it's elevated and there's too much in your system all the time. So dealing with stress properly, exercise, sauna, steam room, body work, adrenal supportive herbs like rhodiola, ginseng, ashwagandha, cordyceps, some of the mushrooms, utilizing all this stuff to keep the stress response in the body under control. Because if you're just chronically stressed and high on adrenaline and cortisol, it's not a good healing state, because the body thinks you're running from something and needs to survive. So it's not really in recovery mode. So that is huge. And then the last one is you're continually re-aggravating the area. This is number 5. If you're not doing proper rehab exercises, if you're just always picking that scab and doing the same things that led to your injury, well, of course it's not going to heal. So you need to enlist the help of someone. You need to not push it too much. There's such a fine balance here. Just as little or too much, both of those will cause problems with healing. Laying around and waiting for it to heal is like, that could take months to years. But overdoing it and overstimulating it could be causing more micro tearing and damage. So you have to find that sweet spot. So that's where enlisting the help of someone who knows what they're doing to create a rehab program, to find pain-free alternatives and other movements and exercises that you can do that aid in blood flow and healing the area without further injuring it. This takes skill and tact. Don't think you can just watch a couple YouTube videos and read a blog and think that you're an expert when it comes to rehab and physiotherapy and just modify it yourself. This is serious stuff. And when it comes to rehab, it's like, do it right and do it right the first time. So that's where it's reaching out to a professional such as myself or one of my colleagues is ideal for scenarios like this. Then we can properly prescribe and remove certain things, and that can sometimes make all the difference. So don't be re-aggravating it before it's healed. And I should also mention, when you're engaging in treatment, for example, when I do prolotherapy treatments with people, which is a dextrose injection into, say, a damaged ligament or tendon, say we're dealing with a tendonitis or like a sprained ligament, you inject those areas. After 1 or 2 treatments, it's going to feel a whole lot better, but it hasn't fully healed yet. Because if you look at the connective tissue time to heal, it can sometimes be 6, 8, 10 weeks to fully heal. But at that 4-week mark, it might feel incredible. That's where it's really easy to do too much, take on too much, re-injure it, re-aggravate it, and set yourself back. So I always try and tell people, it's going to feel a whole lot better before you're fully healed. And that's that gray window that you don't want to overstep and do too much and set yourself back, okay? So there's your top 5 things to look into. If you're not healing from your chronic injuries and you don't know why, let's go through that list together and figure this out. And if you think someone you know would benefit from this, please share it with them. And as always, if you have any questions, just drop a comment below. And thank you for watching.